Two more questions. The gentleman with the
Hi, thanks for a great presentation, a very interesting discussion. I want to go back for a minute to a question that the gentleman over here asked and talk about the difference between environment or the interplay of environment and chemistry. I wonder if in the setup that you gave about the environmental influence on brain development, I wonder if it would be fair to say as a hypothesis that maybe the environment has more impact for prevention and for cure, and brain chemistry and treating of brain chemistry through things like SSRIs are something that work effectively to treat symptoms but don't really address the underlying cause. I also wanted to ask, go back to your Cartesian comments at the very beginning and ask if we're rethinking the dichotomy between brain and mind, as someone like you who's worked with primates, what does that mean in terms of our thinking about the difference between animals and humans?
Yeah.
Thanks.
Great questions. This idea that the medications may be really focused on symptoms and not the cause, I'm sure you're right. I mean, a friend of mine, Ray DiPaolo, who's the chairman of psychiatry at Hopkins, likes to say that when people are depressed, he puts them on an SSRI so that, and he keeps them on it until they can spontaneously recover. And I like that. I think that's actually kind of getting at this point that what the medications are doing is controlling something about the symptoms. I think they really don't even begin. We don't know what the cause is, so we wouldn't know. But I doubt that they're really. And I don't want to belittle the value of medications. Lord knows they've helped a lot of people in a lot of ways. But one of the things they can do is they can help people to actually engage in a process that might make them better. And I think that's what we're getting at here. And your comments are great. That maybe it's this environmental piece that is going to have to be focused on in some way by people who really delve into this. The second piece about the work with animals, I'm very interested in chimpanzees and the great apes, and I spent a chunk of my career studying the brain evolution in primates, and it's pretty weird to sit with some of these great apes. I mean, to realize, I sometimes feel this with my dogs. So, but with these great apes, that they're so sophisticated in the way they can think, and their social behavior is so complex. So it does make you realize that you've got here a great opportunity to understand complex cognition, social cognition, all of that, in an animal that has a somewhat simpler brain. So that is a kind of one take home. But if I had to say what's really different about great ape cognition, or at least cognition in monkeys and cognition in man, I don't think monkeys sit around worrying about whether humans think or not, And I think humans worry a lot about whether monkeys do. And I think that's probably the most fundamental distinction.
last question from Elaine.
Yeah, I noticed that I'm a little uncomfortable with the emphasis on the brain as the material focus of the brain. And I asked myself, why am I uncomfortable? And I'm reminded of my original training at Bellevue Hospital in New York, and the prefrontal lobotomies that were performed, looking at the brain as a material thing. And if we can just cut this and cut that, then we can rewire it. So I left that and went into public health, and particularly for the last 40 years I've been working with alcoholics and addicts. And in psychiatry we have failed dismally working with alcoholics. There was just no success there. But AA and the other 12-step programs have come in, and they have a marvelous success. So I have to ask myself, what is the difference? And the difference is, I think, the support. There's cognition there, changing your beliefs, but it's also the spirituality. And I don't hear that very much in terms of however you define spirituality, obviously not as religion, but as a sense of belonging, connectedness, and so on, which I think is very important in mental illness.
This is a great question to end on, because I think it takes us back to where we started, and maybe it takes us back to Maimonides, actually, to where you started, George. What I would say in response, and I think it's a fair critique that this begins to sound reductionistic when you're so focused on the brain, because what really matters often is social support, or it's other experience, such as a spiritual experience. For those of us who are in neuroscience, it always amazes us that people who aren't would see it as reductionistic, because to us it is really a spiritual experience to start to explore something that is so magical and so mysterious, and something that we know we will never fully understand because of its complexity. So while I can get that sense, and I often hear this from people, that thinking about these disorders in terms of the physical wiring of the brain or something like that doesn't do justice. And it doesn't help in terms of what people need. I think one of the things that it's beginning to do, and I must say we're still at the very beginning of this, is it's beginning to help us to realize something more about the complexity, about the individual differences, the idea that diagnosis is useless in this field, or it's not useless, but shouldn't be reified, it doesn't have any real rigor to it. And it helps us sort of in the way that we did 50 years ago in studying the heart. It helps to it forces us to ask a whole bunch of new questions, both about how someone has a problem and how someone gets better. One of the things in my own work, which has all been about social behavior and how social interaction changes the brain, is to realize that there's probably no more powerful force underneath this. But I think what's driven me most of all is that I was deeply involved in psychiatry research. I was trained as a clinician. And in 1982, I dropped out. I quit. Then I changed fields. I went into neuroscience, and I became a bench scientist, a lab junkie, did a lot of other things, molecular cellular biology. I came back in 2002, 20 years later, kind of like Rip Van Winkle. And that's why I like that story so much. And what shocked me is, in contrast to Rip Van Winkle, nothing had changed. So I'd been in the middle of this revolution in science, and I'd seen so many things happen, and I was shocked. I was completely shocked that the only thing that had changed was that the outcomes were worse, that the social network, the safety network that was available when I remembered from my training was almost completely shredded, was gone. There were places like, as I mentioned, St. Luke's, there were places where nonprofits had filled this gap, but for the most part, we weren't, not only were we not any better, we might even be worse off in terms of what we were doing for patients. And we've been doing the same thing over and over and not really making any progress. And that's when I began to think, we've really got to rethink this in a very fundamental way. Maybe the way that was done for infectious diseases with the germ theory, and the way for cardiology when we began to realize about the different aspects of risk for heart disease. We've just got to completely reorient this field, bring in a whole other kind of science, and begin to actually think about a revolution in the way we think, in the way we diagnose, the way we treat. And I understood at the very beginning that this would be heavily resisted by everyone, particularly by clinicians. And it has been. The only people who haven't been heavily resisting it are actually families, patients and families, like the people with autism or with schizophrenia, who are just feeling so underserved, and they're feeling like they haven't really seen the progress. I'll end with this one other quote from Martin Luther King in honor of this weekend, in his birthday celebration, where he said, in the same sermon, he said, "Somewhere we must come to see that human progress never rolls in on the wheels of inevitability." And I think that's what we're struggling with. Thank you.
Uncle Wade. Before you leave, please, let me express my thanks for all of us to Dr. Insel for this wonderful, wonderful talk. And if I may presume, let me invite a few of the people who really wanted to ask a question, if they might come up and do that. Thank you all for coming. If you want to help us, there are